Hi, I'm Jennifer Halliday, and I'm a proud recipient of a Diabetes Australia Research Program grant. To begin, I'd like to tell you about two very common problems for adults who live with type 1 diabetes. The first is diabetes distress, which is negative thoughts and feelings about the burden of living with and managing diabetes. The second is impaired awareness of hypoglycemia, which is when a person finds it difficult to recognise their symptoms of low blood glucose. Both of these problems can have a serious impact on a person's ability to manage their diabetes and also upon their physical and their emotional well-being. The good news is that both of these things can be addressed with appropriate clinical support and also with treatment changes and structured diabetes education. In order to do this, though, health professionals need to identify people who need assistance. But in routine clinical practice, these problems are rarely discussed. So the problems are often not identified and therefore are not addressed. So for this research project, we'll adapt and trial a simple consultation tool to assist health professionals and people with diabetes to talk about hypoglycemia problems and diabetes distress within routine clinical practice. The Type 1 consultation tool was developed in the UK by our colleagues at King's College London in collaboration with the Health Innovation Network. The tool enables health professionals and people with diabetes to make decisions about and plan the person's diabetes care together. There will be 3 steps for this research project. First, we'll run some workshops with health professionals and people with diabetes to seek their views about the tool. Second, we'll adapt the tool for use in Australia based on the feedback from the workshops. And finally, we'll try the tool in 3 diabetes clinics in Melbourne to explore the feasibility and acceptability of using it in Australia.